So our lines are open here. We're going to try to get to everybody. Everyone hang on tight. So our number here is 602-277-5369, and I'm going to try and stop asking questions and let anyone who wants to call in ask questions so that they can get some free advice right here on the show. So 602-277-5369, and call in and talk about whatever's ailing you whatsoever, and Dr. Dean Silver will get you some answers. So I'm going to go right in with my first caller, who is Josefa. You're on the line.
Hi, good afternoon. I would like to find out if he has any experience with the treatment of myasthenia gravis. My 26-year-old daughter just got diagnosed, and I would like to know.
Well, what is it?
Myasthenia gravis is a disease of the muscles where there's lack of acetylcholine. It's a certain chemical. Where were you guys born?
She was born in the Netherlands. We were in the military, and she was...
Were you exposed to any kind of toxins?
I don't think so.
Well, basically what I do in a case like this, you and I have little batteries in us, and the batteries are called mitochondria. And the mitochondria produce a whole lot of things, including the chemical that she's lacking in. So basically what I would do is investigate the mitochondria to see why she's not able to produce it. We also want to look at antibodies. We want to look at a whole vast thing, but I would look deeply into her genes as well as whatever toxins are in her, and maybe that would be the answer. We do a lot of nutritional IVs to help build that up and help reverse all that.
How old is your daughter?
26 years old.
Well, I'm telling you what I'm going to do. We're going to connect you with Dr. Silver. So the number to call him is area code 480-860-2030, and I'm going to get you connected with him. He needs to talk to you. I mean, that's something I would, in my life,
Yeah,
I never heard.
It's very serious.
So we're going to get you connected with him. Thanks for the call.
Thank you so much.
You're welcome. So now our next caller, again, our lines are open here. Very interesting. I mean, you know, I was very surprised at what she asked. I've never heard of something like that. But you knew the answer right away since 1970 what?
7.
No wonder.
And I'm not telling anybody.
No, not just the world right now. So again, our lines are open here for you to call in and talk about any ailments whatsoever that you're dealing with, and Dr. Silver will give you some advice right here on the air. 602-277-5369, and toll free it's 1-866-536-1100. Nancy, you're on the line. What's your question?
Hi, Dr. Silver. I have this thing that goes on in my mouth, and it's sporadic, but my mouth will just start aching like really bad, and there's nothing you can see. You can't look in there and see something like a, canker sore or a cut.
This is in the mucosa. This is on the inside.
How does she know what mucosa means? Go ahead.
This is in the lining of your mouth, correct?
Yeah, upper, like the top, the roof of my mouth.
Is it along a certain distribution, like on one side, left or right? Does it cross the midline?
Not really. Sometimes, but not always. It's like right now I have it, and the whole roof of my mouth is hurting so bad.
Okay, and you've seen a dentist to rule out anything dental, correct?
I have seen a dentist. I've been to my doctor. I've been to my gynecologist.
Okay. So basically, this may be a autoimmune disease. This may be something the body is kind of attacking itself and setting off inflammation. So again, this could be anything from a virus that's occult that we don't know, from a food allergy to a myriad of different things. So basically, putting on a detective hat, we would try to figure out why are you having inflammation of these nerve roots.
When does it happen?
It's sporadic. Like right now, I have it for I don't know why. It's not like it doesn't go with my cycle, my monthly cycle. It's just.
And you've ruled out herpes and different viruses? Because you don't need a blister to have herpes. You've actually had blood tests, HSV, blood testing for all these things?
Yeah, I've had all that done by my doctor because I was really sick about 5 years ago, and they couldn't figure out why, and I had a bunch of antibiotics. And so they did all this blood work, they did that, they did HIV, they did everything to...
Well, I mean, this could be anything from Lyme to Ehrlichia, Babesia, Bartonella. They didn't do that kind of blood work. We'd have to sit down and figure out what happened a couple years ago when this started and see if anything changed in your environment to cause this. But a lot of us...
Could it be metals?
Yeah, absolutely.
Do you have a lot of cavity? I mean, I'm sorry.
Sure, no, sounds good. Come work with me. We'd have to sit down. We'd have to sit down and go through your whole history, and go even your mom's history, because when she delivered you, a lot of things were transmitted through the placenta, and we'd have to go figure out what's in you that shouldn't be, or what you need that you don't have. That would be my basic paradigm. It's pretty simple. Something's in you that shouldn't be.
Well, it's been like 5 years, or maybe going on 6 now, and it hurts really bad. When it hurts, I'm almost ill.
No, I understand. It's inflammation of the nerves. So we'd have to go and figure out why your nerves are being inflamed.
So here's what I'm going to do. The number to call him is area code 480-860-2030. We're also going to connect you so that you guys can get connected, and he'll talk to you tomorrow. So thanks for the call. Now again, our lines are open here. You can call in and you can ask any kind of question whatsoever about any kind of ailment that you're dealing with. You're going to get a little advice here on the air. And so the number to call is 602-277-5369. Toll free, it's 1-866-536-1100. We have about 5 more minutes to do so.
Let's talk a little bit about natural hormone balance.
Okay.
I've been on natural hormones for 15 years. So what it did for me, it raised my immunity, it lowered blood sugar, it lowered cholesterol, it shrunk my prostate, improved my brain, my cognitive ability, and rebuilt bones and reversed my osteoporosis. So basically the premise is that as you and I get older, rather than accept these chronic diseases of aging, we can slow down the aging process. Taking nutritionals to squelch the free radicals and taking natural hormones. The hormones basically do a lot of positive things. So testosterone is both for men and women, and it's not just for sex drive. It gets rid of one's abdominal fat. Again, blood sugar, cholesterol, cognitive ability, regrows bones, burns fat. So I offer the patients there, if you're having any problem with a belly, with depression, with loss of that make and create and do, natural hormones could go a long way. I also balance brain chemistry by replacing naturally your dopamine, your serotonin, your GABA, so I think that's important. And we also do a lot of detoxification. So the callers that are calling in, we do treat people like that, everything from cancer to cirrhosis to hormonal imbalance. We do breast thermographies, that's infrared screening, that has a sensitivity of 97% to pick up breast cancer. We offer women a morning urine where you can pee and see if you're making the estrogen that causes cancer. So we just need a morning urine void, and we can see if you're making cancer estrogen, and then we can go alternatively to fix that.
So in other words, that they can see whether they have that now and decide whether they want to take some measures now?
Right, we can detoxify the bad estrogen that causes cancer, and we can profile that, and we can repeat that in 6 months to a year, and we can make sure that's gone. My mother had breast cancer. I have that gene, and I gave it to my child. So at 30, she's had breast biopsies. She also carries the gene, and she makes the bad estrogen. So with a morning urine, you can determine that. And insurance pays for most of it. There's a small copay. So for every woman out there, I suggest that would be a good place to start, especially if you have a family history of breast cancer. But most cancers are not genetic, they're environmental. Very few cancers are genetic, maybe 5%. Most of it is environmental. It's what we do to our bodies.
What kind of cancer did you have?
I had a lymphoma in my chest.
Mm-hmm. Wow.
And I have bad detoxification genes.
And how long have you been free of cancer?
For about 12 years.
Yeah.
And that's without chemotherapy or radiation. That's all natural
What
therapy.
do you do for people who have cancer?
I basically give people a roadmap for life, and I give them alternatives. I explain to them traditional therapy. I'm not an oncologist. I tell them to keep their oncologist, their cancer doctor. But we do a blood test from Europe, which actually picks up the circulating tumor cells that'll tell me if they have cancer. They'll then test for 50 different natural substances that'll tell me how to kill it. And it'll give me the kill rate as well as chemotherapy, and we use low-dose chemotherapy. The low-dose chemotherapy doesn't really have side effects. So the whole idea, one can live with cancer. It can become a chronic disease. But too many times, too high doses chemo is given, and the patient in the interim dies. So I'm offering people an alternative. But again, it's everybody's journey, and everybody listening out there with cancer has to understand this is your journey. So I think it's wise to educate yourself, whether that's on the internet, whether that's seeing me, whether that's seeing your oncologist, but get a lot of different opinions.
Now, we only have less than a minute. With this morning urine that people can do, does it help just to detect that, or what else can it detect?
This particular test just looks at 4-hydroxyestrone, which is a cancer-type breast cancer estrogen.
So every woman should basically do it?
I believe so. If you're normal, God bless you. But if not, you can do nutritional changes and sometimes medication. My daughter was positive 5 years ago, and now she has these things on MRI. She's been biopsied. She's 30. So this is an easy thing to fix and prevent.
He's located in Scottsdale. His phone number is area code 480-860-2030. His website is DEAN SilverMD.com. And you can now call him direct at 480-860-2030.